September is the Childhood Cancer Awareness Month. It is also the Hydrocephalus Awareness Month. In some cases, we end up seeing both disorders in the same patient. And that's what happened in yesterday's case. So let's talk about it. Yesterday's case was about a 10-year-old child who has been complaining of severe pounding headaches, trouble with balance, irritability, and severe nausea and vomiting. On exam, they had unstable gait. Fundoscopic examination also showed papilla edema, which is the swelling of the optic disc on the back of the eye, which can indicate increased pressure in the brain. The exam also showed nystagmus, which is an involuntary movement of the eye, which can indicate cerebellum and brainstem problems. Because of these findings, patients got a CT scan and MRI of the brain done. The images below show a mass in the midline posterior fossa that is obstructing the natural flow of the spinal fluid, which can cause dilation of the ventricular system. This is called hydrocephalus. This poor child has something called medulloblastoma. Medulloblastoma is the most common type of childhood cancer. It accounts for over 20% of pediatric brain tumors. As the tumor grows, unfortunately, it can block the flow of the spinal fluid, which can cause hydrocephalus. This can lead to severe headaches, especially in the morning, because when we lay down at night, the fluid can build up and the intracranial pressure builds up in the brain. That causes severe headaches in the morning. Increased pressure in the brain also causes vomiting, irritability, trouble with balance, and can also cause swelling of the optic disc in the back of the eye called papilla edema. In 30% of the cases, medulloblastoma can metastasize easily to the spinal cord. This is why an MRI of the brain and spinal cord is also crucial. The treatment for medulloblastoma is mainly surgical. Neurosurgery will be consulted. They will try to remove as much of the mass as possible. Radiation and chemotherapy can sometimes follow in the treatment plan to just help shrink whatever left over that surgery couldn't get. There are multiple research fundings for these types of childhood cancer and hydrocephalus to help discover the disease and hopefully find a cure one day. Share this video with your friends and family to help raise awareness about childhood cancer and hydrocephalus and spread education about early recognition of signs and symptoms of this disease, as it may save somebody's life one day.